Have you ever wondered why the lining of a woman's uterus can sometimes become excessively thick? This condition, known as endometrial hyperplasia, is not a form of cancer, but it can lead to endometrial cancer in some women. The endometrium, or the lining of the uterus, plays a crucial role in a woman's reproductive health. This lining thickens when a woman ovulates and sheds its top layers during menstruation if she doesn't become pregnant. Regular menstruation usually prevents excessive thickening in women before menopause. The growth and thickness of the endometrium is controlled by two hormones, estrogen and progesterone, secreted by the ovaries. Estrogen is responsible for the growth of the endometrial lining, while progesterone works against it. When there is an imbalance between these two hormones, such as an excess of estrogen without enough progesterone to counteract it, overgrowth of the uterus lining can occur, leading to endometrial hyperplasia. Several factors can contribute to this hormonal imbalance. Obesity is one such factor, as fat tissue can convert other hormones into estrogen. The use of menopause medication with estrogen, such as hormone replacement therapy without adequate progesterone, can also lead to this condition. Other factors include the use of medications that act like estrogen, like tamoxifen, having polycystic ovarian syndrome, or an ovarian tumor that produces additional estrogen. Certain conditions also increase the likelihood of developing endometrial hyperplasia. These include being over the age of 35, never having had children, being in the transitional time before menopause, having reached or passed menopause, starting periods at an early age, having type 1 or type 2 diabetes, or having a family history of womb, bowel, or ovarian cancer. The most common symptom of endometrial hyperplasia is abnormal vaginal bleeding, such as heavier and longer periods, bleeding between periods, or unexpected postmenopausal vaginal bleeding. Endometrial hyperplasia can be classified into two types: atypical endometrial hyperplasia, where the cells within the endometrium appear abnormal and have a higher risk of developing into cancer, and endometrial hyperplasia without atypia, where more cells are produced within the endometrium, crowding together to produce a thicker lining, but all cells appear normal in structure. To sum up, endometrial hyperplasia is a condition where the lining of the uterus becomes excessively thick due to an imbalance of hormones, estrogen, and progesterone. It is not cancer, but in some women it can lead to endometrial cancer. The condition can be caused by various factors, including obesity, use of certain medications, and certain conditions like polycystic ovarian syndrome. Symptoms typically include abnormal vaginal bleeding, and the condition can be classified into two types based on the appearance of the cells within the endometrium.